testing. And we'll be looking at the arthrokinematics. We'll have the patient lying down and we'll be testing an anterior glide for lateral rotation, a posterior glide for medial rotation, an inferior glide for abduction, a superior glide for adduction, and for flexion and extension we'll be testing it with distraction. We'll test with the arm in its rest position, about 30 degrees of elevation, about 30 degrees of abduction, about 30 degrees of lateral rotation. And to test these glides, we can come into this position, apply a little bit of stability to the clavicle and the scapula by reaching around. A bigger patient, this isn't necessary, they'll stabilize themselves, and then grasping the humeral head as close to the joint line as you can, simply glide this backwards and forwards. There. So we're testing anterior, posterior. Okay, and we're looking for the range of movements, and we're also looking for the end fill as we do this. To test the inferior glide, we can stay in exactly the same position, but this time we'll put the thumb into the axilla to stabilize the scapula, and we'll palpate over the humeral head with the index finger. This hand will grasp the elbow, just above the elbow on the epicondyles, and then I shall simply just pull down very gently along the line of the humerus, and as I do so I can palpate the movement with this index finger. I can stay in the same position for the superior glide, same palpation points, but this time just switch my stabilization so that the pressure is on top of the clavicle, holding the shoulder girdle down, and just push up through the humerus. Now there won't be an awful lot of upward glide because this is closer to being adducted than abducted, but there will be some. So, flexion and extension being a spin at this joint, and we're talking true flexion and extension in this direction, not elevation and depression. This being a spin, the arthrokinematic test for this will be distraction. So we'll come back into the same position we were in when we was testing the coracohumeral ligaments. Namely, bring the arm out, bring your hands in as close to the joint line as you can, and then just bring this into a adductive position, well, into neutral position as far as adduction is concerned. It doesn't be forced over, and keep it in lateral and neutral rotation, and then apply your traction like so. I'm sorry, I'm a little bit high. There we go. There. So we can test in that manner, particularly with the bigger patients. On the smaller patients, you can be a little bit more direct and bring your hand into the humerus there, a little bit of stabilization on the shoulder girdle, and use the fingers at the back to palpate the range, and again simply lean out and feel for that humeral head. Now this will work fine on the majority of your patients, but as the patient gets bigger, this becomes less sensitive as a mobility test. And we're looking for the amount of distraction that can occur and also the end fill on that distraction. The point in this particular part of the testing, though, is to stabilize the scapula so that you can, as much as possible anyway, confine the movement to the glenohumeral joint. So, if we want to test flexion, for example, we can stabilize the scapula by applying the border of our hand against the lateral border of the scapula, and then holding the scapula down and then flexing the humerus across the face. For extension, we'll just move the patient a little closer to the edge of the bed, stabilize the scapula by pulling the scapula down and protracting it, and then taking the humerus backwards to test extension. Move across again. For abduction, we can stabilize the spine of the scapula by coming underneath the scapula and grabbing the spine there, holding the scapula down and then abducting the humerus like so. And for medial and lateral rotation, we'll stabilize the coracoid by holding it medially and laterally rotating the humerus, and hold the coracoid laterally, medially rotating the humerus. For adduction, and this does get limited sometimes, though it's usually by muscle, if we just elevate the shoulders slightly, grab the scapula and the clavicle in a grip there so that we hold the scapula up, and then we can take the humerus and adduct it against the chest wall like so. And with the shoulder girdle elevated, there's enough clearance for you to be able to test adduction. Now